With Dr. Fred von Stieff, and today we're finding out more about the purpose and importance of his book, Brain Imbalance. So Dr. von Stieff, first tell us a bit about what makes your methods in detoxification and treatment for substance abuse unique and so successful.
Katie, I've been doing this for 25 years, and I've gone through many phases of treatment. At first, we're very cynical, not wanting to treat people because there is something wrong with them on a psychological basis. Then what happened is I started treating more and more people, especially college graduates and professional people. At one point in time, I had 6 Berkeley graduates and 6 Stanford graduates in a 12-bed detox unit. Suddenly I realized, why is it that these people are so intelligent? Why are these people so kind? Why is it, with such intelligence, being college graduates and naturally other walks of life, how could they be so addicted? What is it that's happening here? At that point in time, with the onset of genetics in the 1980s, and also analyzing the brain chemistry of the 1990s, and then also finding more about addiction, it became very obviously that there was something deep inside the brain which needed evaluation, and we could harness the knowledge to be able to treat people. That's when I came up with the 8 different neurochemical transmission systems, neurotransmitters that is, in the brain, and studied them and applied them to the detox unit, realizing that every drug affected these 8 neurotransmitters, that every medication that we give also affected them. There had to be an imbalance. What I did is understood the imbalance. After that, I performed different types of analysis, wrote it up in a book, and then also applied this also for relapse. You have to treat each individual with their own neurochemical imbalance problems and treat them properly. Without that, you can't be successful. We have definitely been successful in our treatment plan and treated patients more effectively, and that's the basis of the book.
Okay. For what reason would you say you wrote Brain Imbalance?
Katie, I wrote Brain Imbalance because after studying the brain and studying 25,000 detoxes, I knew that there was a continuous thread of knowledge running between these patients in the neurotransmitter systems and what was happening. It's just as predictable as cardiology, predictable as any other discipline in science. There are rules. I analyzed these rules and wrote them down. I was really reluctant to write down 60 rules and put them in a book on the brain, yet I said that they should be rules.
Okay, so what kind of audience did you intend to capture with this informative book?
I have had specialists read this book. I have been privileged to have reviews from doctors in New Zealand, Australia, Africa, and all over the world. Doctors will write or call me on the phone and ask me about specific patients they have because they've read the book. I have really been surprised, and I've actually had college students, people that are medical social workers who have said that without that book they would not have the answers to be able to tell their patients in a realistic way that's beyond psychology, to help them understand that they are not so guilty of the poor willpower and not understanding why they have these cravings and why they use. So it is for them. It's not only for the patient, but it's for healthcare workers and all the family members, the mothers, the fathers, who have someone in their family who are addicted, that do not understand, and they feel guilty themselves for the circumstances and the consequences of their loved one's use. So it's for them.
Okay. Well, that covers a wide audience. So what do you hope to accomplish with this book, Brain Balance?
I hope to accomplish a new perspective, a new understanding, a new depth of thought, a new way to help people understand that this goes beyond the psychology, beyond the poor willpower, beyond the shame.
Now you say poor willpower, that's what they've been accused of having in the past, right? And you're saying it's not that. It's not about poor willpower. It's something deeper, right?
It's deeper, and a lot of people say that it's totally controllable. And also, even with the failures of controlling their addiction by other physicians in the past, these people continue to use. But there is another answer to turn these people around. But also the family members have to understand the neurochemistry, the genetics, and the real reason why the people continue to use and what can be done. So it gives them a little bit of hope and trust. What happens is hopefully it'll ameliorate or decrease that feeling of anger, guilt, and then also makes them understand that there is a reason for this, when right now they don't understand the true reason for it.
Okay. All right, so my last question is, do you have plans for any future books?
Katie, there's always a puzzle of addiction out there. You know, we're taking the pieces and trying to put them into some constructive manner to be able to have people understand addiction. For now, nobody really understands it. It's a mirage of guilt, shame, and also not knowing how to do it. But there are answers. In the future, we will be writing a book on more on how the government, how individuals, how the medical community has placed this thing on a psychological blame system, of which there's a lot of money, empowerment, and then also to where people should actually know what's happened and what we have to do in the future to reorganize the treatment of addiction and try to prevent the 26,000 deaths every year from Oxycontin and other drugs, and that little is being done about that.
Okay. All right. Well, thank you for coming in today.
You bet. Good luck with reading the book.
Thanks.